In this video, we're going to be talking about the jaw and their role in headaches. A jaw problem is often labeled as TMJ, which stands for temporomandibular joint. TMJ is just a label that's given to people with jaw problems. It doesn't actually tell you what the specific problem actually is. So the TMJ is the joint in the jaw here, which connects your bottom jaw to your skull. And the joint is just here in front of the ears. And if you put your finger here and then open your jaw, you will feel it move. Now, what should happen when you open your jaw is that your jaw is actually on a disc. And so what should happen is as you open your jaw, it should glide nice and smoothly. So if you have any grinding or any clicking, it can often be some wear and tear within the joint itself, causing a bit of a grinding, or if it's clicking, it can be where the jaw is coming off the condyle. This is often due to a problem either within the neck, which we discussed before, or it can be a problem within the muscles within the jaw itself. So let's start with the muscles in the jaw, of which there are three main ones. One of them is called the masseter, which is just here. So if you clench your jaw together, you will feel that right in the corner of the jaw, you'll feel that muscle bulge out. This is one of the muscles that's involved in closing your jaw. So the reason why this is important for headaches is because the muscle itself can cause some headaches, and it can cause problems within opening that side of the jaw. So if you have a really tight muscle here and you go to open your jaw, what's going to happen is this one's going to move more, this one's going to be locked, and so when you open your mouth, your jaw is going to go off to one side and is going to deviate to the tighter side. So something that you can do to test this in yourself is you literally just look in the mirror, fingers here, and then slowly open and close. And then you want to do two things. One of them is actually feel is both joints moving at the same rate, and also see if your chin is in line with your jaw when you open it up. If you have one side that's tight, say this side for example, your jaw is going to deviate away from the midline of your nose, and then you'll also feel this one open up more by your finger. So what you can do to help that muscle is literally just to relax your jaw and massage it. Again, you can also try some heat around the muscle to help with the blood flow through the muscle. And then another tip you can do is to press into the jaw and up, and then slowly open your jaw, and this is known as fascial release, which helps with the connective tissue through the jaw to release the muscle. Another muscle involved in the jaw is a muscle called the temporalis, which is right up here in the top, and that can cause headaches in that exact area. So if you have a headache in the temporal area, then you may have a problem with this muscle. This muscle closes the jaw. So again, what you can do is you can massage this muscle, you can apply some heat, and then you can also do the fascial release again, which is where you start with your mouth closed and then slowly open and push upwards, and this will release some of the connective tissue around the muscle to help it relax. The third group of muscles involved in jaw problems are a little bit more difficult to get to. They're known as the pterygoid muscles, and they are right in deep inside the jaw. So if you've been to a dentist or a chiropractor, they have tested these muscles on the inside of the jaw. They can be incredibly tender and a big cause of problems. These muscles actually open your jaw. So the way you find it is on the outside of your gums, right at the back, and then the way you can help it is by opening and closing your jaw and just applying some pressure to that section. Now, all of these muscles are all controlled by the nerves which come from, you guessed it, the neck. So there's a study done that when they compared muscles tensing in the neck and muscles tensing on the jaw, if you move your neck, the muscles in the jaw tense, and when you tense your jaw, the muscles in the neck also contract. And that's because they have the same nerve root. So if you have a problem within the neck, that can cause a problem not only in the neck but also in the jaw. That then can cause some dysfunction, some imbalances, which then can lead to labels like TMJ or pain in your jaw. The third thing that jaw problems can cause is they can actually be a cause of migraines, which we'll talk about in the next video. The reason for that is because the nerve which can cause migraines actually comes through the jaw. So again, you have the nerve roots which come from the neck. This comes through that masseter muscle that we talked about, so it can get pinched on the jaw, and then that can cause a one-sided headache or severe migraine. So in order to try and help that type of migraine or help that jaw problem or the neck, you need to make sure that your neck is moving well and your neck is all fine. You also need to make sure that your jaw is good, so then you can prevent the migraine, prevent the jaw pain, and prevent the neck pain. So to summarize the jaw, you need to do everything that we mentioned in video 1 regarding cervicogenic headaches. You also need to check in the mirror, have a feel of yourself in regards to how the jaw is moving, the symmetry of the jaw, and if none of those things are helping, make sure you see a provider who can properly assess your jaw and see what's going on and see what needs to be done to get you better.